Here we go. It's very cold. And what care? What health, social care? Rain, rain, rain. What they say, go away, come back another day. Okay, so let me just get rid of that one. So here we are again. It doesn't take since 23rd November offer 2018, and we're now, when we now, Friday the 8th of February 2018. And it doesn't take the maladministration and breach of the national and local statutory regulations and frameworks and pathways and all these buzzwords and policies to affect those that may need the offer of goods and services, and as a consequences of deliberate cutbacks and services means leaving the vulnerable, the elderly, disabled, whatever your situation, literally having their fundamental human rights violated repeatedly and targeted unlawfully. So when you research and find out the evidence of fact, of first-hand knowledge, and who has been behind what, and who has, in their civil servant role, they're breaching their own code they signed up for, and their employment status as a public servant in the United Kingdom, whatever role and subject may be. But for example, my situation, it's been a whole year of lies, disinformation, delays, wait, deliberate traumatisation, deliberate breach, and it's all about trying to survive out of the state system and trying to regain some kind of God-given rights we're all naturally born with. Now, man and woman were all born meant to be equally, but the status quo nationally, it's wider. The gap is in reality on ordinary everyday situation. So the only way one may, and I'll put that in big bold letters, may, M-A-Y, one may get offer services if one ends up in a situation, an emergency. God forbid you end up in a hospital or something. And that's all privatisation anyway. So there's no such thing as, unless you have on a tap your family, DNA family members around you, to be able to step in, you've got no chance of getting anything, any support whatsoever. So you see, when I made it clear that private friends are struggling and how and what one needs and requires, well, you hear in reality that not just my age group, but all different people's situations have no funds, no monetary access to their own funds out of the life birth certificate trust bond, and that was created. And when you study information and you just hold these civil servants, especially managing directors and CEOs, accountable for the maladministration in many areas, and especially when you've got evidence of the abuse, psychologically, physically, and it's happened in a setting of public funded setting. So the buck stops at the managing directors, board of directors, these men and women who hold the public strings. So-called consultation for changes in policies and services doesn't mean nothing anymore, because what really goes on behind the scenes is already decided. So it's all just a cover front, really. So we don't realise the psychology and the mentality of these individuals and their positions, and how they get into their positions is not by chance, and how the public, ordinary people who may not be in a situation like I, too busy struggling to put food on the tables to care. Or they do care, but they can't speak up because they're too busy to survive. So the constant targeting, the vulnerable, the elderly, disabled in ways I can't even comprehend. I have somebody banging at my door at 4 o'clock in the morning. Woke me up. No, I don't know whether I was dreaming and speaking out in my dreams. But all I do know, that woke me up, someone banging at my flat door in the hallway. So, well, there's a certain security measure we've taken anyway, my private friends suggested. And whatever that was, there's no note from a neighbour. If it's genuine, there would have been a little note or something from a neighbour put in the door, are you okay, blah, blah, blah. That didn't happen. So it was pure chance. I had a recording app running still. As it woke me up, and I was opposite texting my friend. As she said, just keep the recording app running as I fell back to sleep. So I did, and I caught a lot of evidence on a recording app. So certain subjects you learn about and come across, be careful where you share your information. The darker side of life is real. It exists. And there's a reason why they deliberately block services to me. And it's been going on for quite some time. And when you connect the dots and you have evidence of actual first-hand knowledge to back everything up, then you have, well, you see, certain individuals are in the pockets of certain, you do me a favour, I do you a favour. Certain clubs, certain, you see, if you don't believe there's a spiritual war going on for the souls and the minds of those that are just trying to survive and done nothing to cause anyone any harm, injury or loss within the natural frame of life itself, and it's unfortunate situations you come across, the ordinary Joe Blog tries to work and do his job at the front line, but it's a management level, it's the directors, it's CEOs and who they're interlinked with, not just on the local scale but nationally. And all I have to say, in my opinion only, is to be prepared. Just be prepared, because if you have an old wind-up radio, basic things, natural, you know about certain things that help you naturally, your body, your health. Because yesterday I said about this dental thing is still going off, and today it's automated computerized responses, no human individual. So you just look outside your window. Ever done a video when it rains? You ever notice anything abnormal about the weather? You ever notice subtle things are happening you could call it by chance? You see, how many of us are relying on mainstream services, and where was the NHS before it existed? What happened? Where was the pharmaceutical industry before it existed? What did people do then? You're going back in history. You might think, oh, technology exists, modern technology, no. All the computer data is all interlinked to services, especially public sector. And if we don't research who's connected to who, in business as well, certain individuals, I found out, are connected to bigger privatisation corporations already. And that's what's bringing in the United Kingdom. Well, England, I don't know about Scotland or Wales, but England especially. and how it filters down to every town and city. And they call it in statute law borough councils and county councils. It's massive. It's more. People will try and think there's democracy. You have your say. You think how much these commissions and these men and women in their job as a civil servant role as commissioner running public services, how much they're earning per day. And yet ordinary people struggling with illnesses and disabilities and their own owns can't even get barely that per week to cover their personal needs. And there's the National Statute Duty of Care, which has already been caused maladministration and breach of human rights. Article 3, degrading, inhumane is deliberate to cause psychological distress, even more physical harm. In the putting one at risk. You see, you need to cover yourself with facts, with evidence. So when you email and you cover it documentation and you sent 3 emails, I'm not going to do it again. And that document of fact, of evidence, first-hand knowledge. And tomorrow another document will be going out by this time, by a different manner. And in a different subject. Because unless you rebut something that isn't fact, it stands as, in the eyes of administrators in their job role with public services, as fact. So say, God forbid, you end up in an emergency situation, yeah? And you don't know what data they've got on you. And then their access and computer systems is all interlinked with a certain software program. And you don't believe that they're just looking at you as a tick box exercise, and that's what it's all about. It's a numbers game. It's commerce. It's business. It's not personal, but it does damn well feel like it. It's business. They look at the bigger picture. They raise the council tax. I mean, what is council tax for, you might say? I'm not expert in it all at all. I just know the fact that certain national other subjects are still blocked to having a response since November, beginning of that month, and the end of the month. So why should the individuals have to get off their sick bed when they're too ill to try and find access to services to assist in that matter? I found out it's a deliberate character assassination. You need to be careful about the comments and assumptions made about your individual circumstances, your personal life, your character. They've got nothing to do with nobody, but that will get misconstrued. Let me just turn this off as well. So it's like a conveyor belt of life, time, and there isn't any care. There isn't. Those that really do care are absolutely struggling. In many areas, really. So just trying to. So you call it like the regulations, statutory regulations, United Kingdom, right? There is everything in place, what's meant to be available, social care, national directive in needs assessment. So, for example, there's a case reopened and they call it local government ombudsman in UK, but it's actually health social care, and this goes back to May 2018, reopened. And what I experienced, and I got decamped, they call it decamped, and I got this evidence. I can't change what's happened. And I just only pray and hope these individuals, what goes around will come around, because they severely harm me. So, of course, the psychological effect on the trauma is deliberate. all these years on, trying to offer me service by the same company. I'm finding out certain individuals are still head over to certain departments within that same company. So when you have text, video, photograph evidence still, and you find it, I am a living, breathing, flesh and blood individual with same rights as anybody else. And just because the ill performance and health does not stop anyone to try and imply they have authority over me, do not. You look at, we're governed by consent, and research that if you care to go into those avenues and realise that if you step out of that box, out of the statutory regulations, codes, etc., you're treated as commodity, not as a, born, with a rubber stamp across your forehead and a fingerprint or footprint on their Crown Corporation birth certificate. So you see, unless you claim that live birth record, it's all fraudulent to claim that the man or woman or individual represents that uppercase or lowercase trust created by the Crown State, Crown of England, Treasury, and that's where all this taxation. But does all the taxation really go back into the public purse for services such like offer of a care needs assessment, which has not been completed? I've got this in black and white, dated Wednesday the 19th of 12, 2018. An employee assessor claiming, until I've exhausted all the avenues of in-house this area, complaint, they couldn't statute or complaint, but if you look at the word and definition in Black's Law, edition 4th or 5th, and see these definitional words and meanings, you'll begin or learn. You see, when I ended up in this Pine Lodge placement, the previous public servants, healthcare professionals are called, social workers, lied to me. I've got their evidence on Texas still. And I had, all those years ago, a human rights lawyer, public law lawyer. And when you find out they called it, this company, LGSS Law Limited, who now has a wider spectrum representing all these so-called corporations locally, widespread in certain counties. And you find out who the directors of these companies are connected to. And when you find out it's contracts, offer contracts, and you learn how to accept, and you turn the tables and you set your terms, what you require. And if you have difficulty getting your views across, you need to really find, and it's difficult if you don't have close family, to get your views across. And the changes are happening where, despite what's happened before, do you think, I couldn't allow anybody back in by that company, my own? No. So I sought this other alternative, which I had to find. And it's known as United Kingdom as Better Healthcare Fund. National statutory services known as Department of Health and Healthcare, and with NHS England Limited. Well, there's meant to be a linked up services now, but they're all run by mainstream, again, so-called. If you look at what the word government really means, you'll find out a lot of things. But for now, I sought clarification and evidence of first-hand knowledge, copy the local constitution in this public-run company nearby me, and the evidence where it states that one needs such and such of particular action or service first, in line with national care needs assessment procedure process before one gets referred to the specialist long-term particular certain department. And for the past year, they haven't provided the evidence to hand, ever. They haven't got it. So I sussed that out, and so when you have deteriorates and you end up, as I said, in this other side of the National Health Service known as in the United Kingdom, and the various set-off of the public services and all that going on too, you find that when you seek clarification of what may be able to offer on a discharge linked up service, it doesn't exist. They cherry pick who may be able to get offered what service. And you've got private contract, private healthcare company come in, and the public funds is being spent on a huge amount of the Shaw Trust PF. It's a private contract out of public funded services to private companies, healthcare, and then they rebrand the words like assisted living. Well, it's nothing like that. It's not what you think it is. So I'm gonna go now and chill out and keep warm somehow, and best one can with this dental infection and with the natural health I'm trying to, and I have to be bed rest again. So that's all you can do. Keep warm and keep covered up, and before you go through it like yourself, you're not aware. I don't really know. I have a gut feeling what they are doing already more than ever. But this is unlawful. And they just want, it's like if you look at national picture, you find out that you're not alone in all this, or you might feel it's all personal. It's happening nationally. And it's like, it's meant to be inclusive. All these policies, new public buildings, and how many civil servants have got working across from me is unreal. This is a pen pushing, well, computerised, pushing the buttons for them, and they don't care. So the care has gone out of care, and they care about their jobs, and they got unions. They care about their own positions. They don't care about the ordinary members of the public, and God forbid if they have an accident, will they be covered? Of course, the public purse is paying their wages. So there you are, off to rest. No conclusion, it's yet again. No remedy, yet again. This is nothing new, because Teresa Grant is a CEO of one of these companies. And when you know there isn't any dignity left in so-called NHS, and all your data is being held in the cloud and other software too, so by 2030 and 2024, we will be turning into digital robots. God knows, who knows. But the CEO of the Department of Health and Social Care, you really want to find out who he is. And Ian Hudson in UK, it linked into big pharma and health, so-called regulation and statutory law too. But you just try and do this in the simple basic things. You try and find a Bar Society lawyer member that gives the monkeys, unless there's a profit making to be made by that individual. And when you find out, when you go to the likes of certain individuals and family members, you find out who they're connected to. behind the scenes. There's no such thing as patient safety. They don't give monkeys. The director of this area of CCG, that individual's got links to other people in the same area. When you find out the new individual runs a certain device, he's got 23 years in the former police service. And then you link up, he also used to work in adult safeguarding as a consultant, as a private company, making profit, as well as working in NCC, a civil service, public funded services. And then you link up the connects and service delivery, who's got the governance role in making sure things are done for the public. Well, again, so-called Disability Resource Centre. And then you go look down the chain down to other individuals, their work history. Be aware, be safe, be careful. Your rights, well, are meant to be there. In reality, I think a lot of us, in many different situations and backgrounds, are trying to blow the whistle and uphold those to be held accountable. So I'll leave this with you today as end of the week. The degrading, inhumane, again, treatment by individuals, they know who they are, causing the deliberate deterioration in one situation, and especially where they know that you have evidence, as I said, of first-hand knowledge that you didn't do this and didn't do that. These men and women, ordinary individuals working on computers, has case files very high, and yet they're prioritising the easiest, the easiest cases first. Anyway, we're going to put some music on now. We're going to chill out. I can't play music on the channel, but be aware that all you individuals that you think you're causing more deliberate harm, alarm, distress. I do have these essential, you're causing the exceptional circumstances and greatest essential risk to I. And you know exactly what you're doing because the evidence is there in black and white. You see, if you don't realise that these are the consideration of your personal situation is never fully taken consideration into account, for example, and you've got various good groups out there trying to raise awareness, but the conditions of what you're left to live and cope with, it's people and it's deliberate, unlawful. So God bless, keep safe, keep your spirits up, try and do the best you can in limited situations. Is there a remedy? Yeah, I'd like to see there is one at some point, somehow. So you have a diagnosis of your physical medical condition, you see, and still you get blocked to access what you need. They call it intermediate care team. Yeah, what is that in reality? When they're linked up is with NCC Limited, NGH, NHS Trust, in conjunction with NHS Foundation Trust. Also with the framework nationally joint, it's Clinical Condition Groups UK, and then the medical nursing. There's clear evidence on your medical records when it comes into the funded NHS England Limited to practice medical practice, especially when there's a block since the 21st of May 2018 on a CD format to my summary care records, to blood tests, MR scans and all referrals, grounds for the referrals as well to date. Logically, come on, think about it. Who would delay your lawful access to your own data since May 2018? You work the dates and how long's it's been. Signing out. God bless. Please keep safe.